the costing that you would look at for a full mouth rehabilitation and dental implants?
Okay, before I talk about costing, you need to understand this is a life-changing process.
Okay.
Okay, so I understand cost is important, but if it is not done well, you will remember the doctor for the rest of your life.
No, not in a good way.
Not in a good way. Okay, so make sure that you go to the right doctor to get the right work done. Okay, now that aside, now cost depends on how many implants we place.
Okay.
Now obviously, the more the implants, the more the money. Second, it depends on temporization. That means there are ways sometimes we place the teeth immediately, as in you come in the same day without your teeth, and on the same day you get your full teeth before you walk out of a clinic by the end of the day.
Okay.
So that is an extra cost. After that, you wait for 3 to 4 months for the implants to heal. Then comes the cost for crowns, because you need permanent crowns. Those crowns depend on what kind of crowns you go for. There's something like a plastic sort of a crown, and then there's the ceramic crowns.
Okay.
So they vary by cost as well.
Which one's more durable?
Ceramic, of course.
More real looking also?
I think both are good. Both look good, but ceramic lasts longer.
Okay. Does insurance cover a full mouth rehabilitation dental implant?
A dental implant procedure in India will cost you anywhere between, by a good specialist, will cost you about 5 to 6 lakhs.
The whole thing?
Yeah, the whole thing. Insurance usually doesn't cover it unless you have a specific employer insurance which covers this sort of thing. So I would suggest, instead of me telling you if it covers or not, I think you should check with your insurer.
Is it an aesthetic procedure,
No,
or
it's
is
not.
it a more,
See, I would like to think it's not an aesthetic procedure, but the insurance classifies it as aesthetic procedure.
okay.
But full mouth rehab is not an aesthetic procedure. You're doing it to improve your lifestyle. You are improving it to eat better.
Right.
The reason teeth are in your mouth are for a reason.
Right.
That reason is for you to crunch your teeth, make it into a soft bolus so that your stomach can absorb it. That is the main function. If you're not chewing, your stomach is not absorbing. If your stomach is not absorbing, you are malnourished. So it is the essence of life to have teeth. So it is not aesthetic by any sense. It is very functional. It is so important to have a good. You can't appreciate food. You can't appreciate taste.
Right.
So let's assume you now like a peanut masala is what? You can't swallow a peanut masala.
Right. Can't make it into a paste either.
Yeah, you have to crunch it, and that's how you get to know what it tastes like.
Right.
So you can't just nibble and swallow, right? So
Okay.
that's the essence of life. So I would differ on if it's an aesthetic or functional, but I think insurance calls it an aesthetic.